Hello and welcome. My name is Joy Eden, and for my SSM project, I will be talking about the female reproductive system, specifically talking about the breast. And without further ado, let's get started. So firstly, we'll look at what is the female's breast. So basically, the breast is a pair of glandular organs which is situated in the anterior thoracic wall in the pectoral region. Breast exists in both male and female, but it is more developed in females. And one of the few functions of breast is to produce milk for breastfeeding infants so that they will be able to get their nourishment, and it also serves as an important secondary sexual characteristics in females. Now we look at the anatomy of the breast. So over here we have the location and the quadrants. Firstly, we'll look at the location of the breast. Now imagine this is the right breast and the nipple serves as the median. So horizontally, the breast expands from the lateral border of the sternum towards the medial axillary line, and vertically, it expands from the second costal cartilage into the sixth costal cartilage. In terms of quadrants, the breast contains four quadrants, which are the upper outer quadrant, upper inner quadrant, lower inner quadrant, and lower outer quadrant. As you can see over here, the inner quadrant of the breast is closer towards the median, whereas the outer quadrant is closer towards the lateral. Now we'll be looking at the anatomical structures of the breast. First of all, as we can see here, these blue structures, they are known as the mammary glands. And inside the mammary glands are approximately 15 to 20 lobes, which contains lobules, and inside those lobules are alveoli, and these alveoli will then start to drain into ducts known as lactiferous ducts towards the nipple. So the nipple contains small nipple pores, which is a continuation from the lactiferous ducts, and it's where the milk will come out. And there is a pigmented area of the skin that surrounds the nipple, which is known as the areola. And the areola contains sebaceous glands known as Montgomery glands, which will lubricate the nipple and prevent it from cracking during breastfeeding by producing oil substances. Now, as we can see here, there are these orange space in between each mammary glands. These are connective tissues that are made out of collagen and elastin, and at some point they will come together to form a ligament that will make sure that the breast is attached to the pectoral fascia, and the ligament is known as the Cooper's ligament. And lastly, we look at these yellow-like structures. These are adipose tissue, and these are what gives a circular structure of the breast, and it also supports the glandular organs inside the breast. And also, the mammary glands are lined with specialized cells known as the myoepithelial cells, which is important in ejecting milk from the mammary glands and towards the nipple, which we will be looking at the next slide. Now we look at the mechanism of lactation, basically the production of milk. As we can see here in the diagram, the lactation process is actually stimulated when the baby starts to suckle on the mother's breast, and the mechanoreceptors in the mother's breast will then send signals towards the mother's brain in the hypothalamus, and then the hypothalamus will then send signals towards the pituitary gland to produce certain hormones. Firstly, the hypothalamus will send an on signal towards the oxytocin neuron at the posterior pituitary, and this will cause the production of oxytocin hormone. And then the hypothalamus will also produce an off signal towards the dopamine neuron in the anterior pituitary. The dopamine neuron is actually an inhibiting neuron of prolactin neuron. So with that being turned off, the prolactin neuron will be able to produce prolactin as much as it wants. And these two hormones are important in lactation because firstly, the prolactin will be used to produce milk in the mammary glands, whereas the oxytocin will be responsible to make sure that the myoepithelial cells, which lines the mammary glands, will start to contract to eject the milk out from the mammary glands towards the nipple. And this basically sums up the mechanism of lactation. Now we'll be looking at the diseases that are related to breast and the treatment for this disease. And one of the most common diseases related to the breast is breast cancer, where abnormal breast cells will proliferate at an abnormal rate, and this will produce tumors, as we can see over here. So here are the few symptoms that could occur in an individual with breast cancer. First of all, there's skin changes. And when it comes to skin changes, basically means that the person may have a change of skin color of the skin around the breast, or this breast skin may also occur thickening. Now, in terms of nipple changes, one of the nipples may become retracted or inverted, and the nipple position may also change, which causes the nipple to point at a different direction, and this will cause that one nipple to become asymmetrical with the other nipple. And the lumps or nodes may also occur in someone with breast cancer, and this will cause armpit swelling or collarbone swelling due to enlarged lymph nodes in the area surrounding the breast. In terms of treatment, it can be done through surgery, radiation therapy, and also chemotherapy. So when it comes to talking about surgery, usually it can be done by removing only the cancerous tissue, which is known as lumpectomy, or it could also be done by removing the whole breast, which is known as mastectomy. And in terms of radiation therapy, it can be done either externally through targeted radiation, which is delivered from outside of the body, or also internally by placing radioactive seeds in the tumor site. And radiotherapy is important to destroy residual cancer cells in the breast or chest walls after surgery is done. And then lastly is the chemotherapy, where drugs are used to kill cancer cells throughout the body. This method is usually done either before surgery or after surgery to lower the risk of reoccurrence of the cancer. And lastly, we'll look at one of Malaysia's known specialists in breast, which is Professor Emeritus Datuk Dr. Yip Chen Har. So she is a leading figure in the breast cancer research and treatment in Malaysia, as she has conducted researches on breast cancer of Asian women, where she focused on genetic factors, risk assessments, and the treatment strategy, which has significantly advanced the understanding of disease of breast cancers. Not only that, but she was also the professor emeritus at the University of Malaya, where she established the first ever breast clinic in Malaysia, which is known as the University of Malaya Medical Center. And she has also passionately advocated for breast cancer awareness by doing a lot of activities where she engaged with communities, such as doing public talks or workshops where she was able to educate women about breast health. She also promoted early detection through screenings and self-examination through public health initiatives so that she is able to increase the awareness of breast cancer. And her contribution to Malaysia in terms of breast health has increased the capacity of high-quality breast cancer care in Malaysia, and also improved the women's awareness of breast cancer in our country. And that marks the end of my presentation. Thank you for listening.